For WWAMI students, in the 3rd and 4th year of their medical education, the opportunity to experience medicine firsthand in several clinical settings across the 5 states often determines their ultimate career path. It is also a chance for experienced doctors teaching these students to gain inspiration from these inquisitive minds.
By far, my favorite rotation was OMAC, where I went there to do family medicine. I was a little nervous about going out into the middle of nowhere, or what to me felt like the middle of nowhere. But I really enjoyed it because of the intimate relationship that you develop with your preceptor out in WWAMI land, because it's just you and the doctor. So your learning is of paramount importance.
Under the classic model as it currently exists through most medical schools, third-year students do training in what we call clerkships, time blocks of anywhere from 6 to 12 weeks within the major fields of medicine. Once they get into the 4th year, they continue, but they continue at a more advanced level, and it is much more at an elective level, meaning they begin to handpick specialty areas that they might want further training in before they move on to their residencies.
Where I went to medical school, there were basically 3 sites where we trained, and here there are sites at all these states, and the students get to go out with practitioners in rural communities and in smaller communities and work one-on-one with an attending, which is astonishing. Where I trained, it was more like 3 or 4 students with some interns and residents, so it was a much different experience and exposure.
I did my first year of medical school in Pullman, which is actually really how I ended up in Pullman, because I really liked living here. Getting to know your patients, sometimes they're neighbors, sometimes they are people you're going to run into in the grocery store. There is a lot of accountability that way. You really have to always be, knowledgeable and caring, and you can't just clock in and clock out if you're going to be a rural physician. We all love to teach. You get so much back from teaching. You have to know what you're talking about when you have students with you, and they are constantly asking questions that I don't know the answer to, that I have to look up, and they really make you better at what you do. So I get a lot out of that. Enthusiasm, passion. That enthusiasm kind of keeps you going, and it gives you that, oh yeah, this is why I love my job, feeling.
My first rotation was in Yakima, where I did OB, and then I went to Spokane and did my surgery rotation, and then I went back to Seattle for a few. Was in Seattle for pediatrics, inpatient pediatrics, inpatient internal medicine, and inpatient psychiatry, and then back out to northern Idaho, back to Sandpoint for the rest of the year. So the big draw for the Wright program is that we get to spend 5 months in one clinic with the same doctors, seeing the same patients.
Working with Denny, he's a great, enthusiastic learner. Patients ask nearly on a daily basis, is he going to come back? Is he going to be a doctor here? When can I sign up? They're really excited about these young students.
When you work with someone day after day, week after week, and even month after month, you start to focus on the things that they have to teach you about every individual patient, and you're less caught up in making sure that you do things the right way, and you're more focused on your learning.
What I get as a preceptor working with the students is certainly there's a freshness, a newness that the students have coming. There's an optimism that they really want to help people.
You really get to experience what the work-life balance is, and we get to see in our preceptors how they handle that, which is something that is really invaluable. You get to see what it's like to be a family doc in a small town, as opposed to just seeing your preceptor for a few hours at rounds in the hospital.
Idaho ranks it right now 49th in the nation in terms of physicians per capita. We have one of the oldest physician workforces in the nation, so because we don't have a medical school in Idaho, we have to always import from the other medical schools, and having the connection with the University of Washington has been a good thing. It turns out that our very first student is going to be returning to practice. She's actually bringing her husband as well, so we got 2 physicians coming back to Sandpoint in exchange for having her here about 5 years ago. And that's what we're hoping to see, not just for our community, but for communities all over the rural West.
So for my future right now, obviously I've got the next 3 years planned out. I'm fortunate to get to go to Stanford.
So I've matched into internal medicine residency here in Spokane, and most of our work will be based at Sacred Heart Medical Center.
Luckily, I had good news. I got my first choice, and I'm headed to Santa Barbara for general surgery training.
I've had such a wonderful experience in Spokane. I could certainly see myself coming back here when it's all said and done.
Our goal is really to serve the community, and I think that the UW does a great job of modeling that to its students and to the larger community, and that's what really sold me, because that's why I want to be a part of medicine. I want to help the community at large.
The first 40 years of WWAMI has been extraordinarily successful. WWAMI has met the goals established by the founders. WWAMI has been innovative. WWAMI has become a benchmark program for community-based education that serves the needs of the entire community. That is an educational program that's focused on reducing the cost of education, a program that is noted for better health care for the individual, better health for the population of the WWAMI region, and a reduced per capita cost of those health care programs. I am very enthusiastic about the bright future of the next 40 years of WWAMI.